I rise today in support of the Patient Protection and Affordable Care Enhancement Act. From skyrocketing prescription drug prices to rising premiums, too many Kansans are struggling to afford the basic costs of health care and access to coverage, a problem that has only grown during this public health crisis. And just last week, in the middle of the coronavirus pandemic, this administration asked the Supreme Court to strike down every last protection and benefit afforded by the Affordable Care Act. A new report found that a number of Americans would lose health coverage if this lawsuit succeeded. 23 million people, including 94,000 Kansans, would lose their health insurance. We need to build on the progress of the Affordable Care Act to lower the cost of health care and prescription drugs, not rip away people's health care in such an important time during this global pandemic. And that's exactly what the Patient Protection and Affordable Care Enhancement Act would do. This essential legislation would help lower the cost of health care, bring down the skyrocketing cost of prescription drugs, crack down on junk insurance plans, and strengthen protections for people with pre-existing conditions. Importantly, it would also help states like Kansas expand Medicaid, providing an estimated 150,000 Kansans with affordable, quality health care. I've long been pushing for Kansas to join the 36 other states that have already expanded Medicaid so that we can lower the cost of health care and increase access to health coverage, meaning more people are protected during emergencies like the coronavirus pandemic. I'm proud to have helped secure vital provisions in this legislation that would give Kansas more urgently needed money to expand Medicaid. By renewing the ACA's original expanded federal match, we could both incentivize states to expand their Medicaid programs and ensure a smooth transition for those that do so. While this administration works to tear down the ACA in court, I'm working alongside my House colleagues to strengthen the ACA and help ensure that everyone can receive affordable, quality health care. Because during this time of uncertainty, no Kansan should have to worry about whether they will receive the care that they need and that their families need to stay healthy. Thank you, and I yield back.